Hello, everyone. Welcome to the session, RWE and Digital Health in Africa, Opportunities, Challenges, and Path Forward. In this discussion, we look at how these technologies are being applied in practice, the barriers that need to be addressed, and the strategies that can help scale sustainable solutions. Our goal here is to explore how RWD and digital health can work together and create a more efficient, accessible, high quality healthcare across Africa. We have an excellent panel of experts with a diverse experience in digital health, analytics, and healthcare innovation. So I'd like to introduce our moderator for the session, Shereef Ibrahim, an experienced medical manager with over 15 plus years experience in multinational pharmaceutical companies across Middle East and Africa. He's a recognized medical affairs thought leader and a writer with a proven track record in medical strategies, leading multicultural teams to achieve patient-centric objectives, many of which have achieved global recognition and awards. Next, we have Ranin Soliman. She's an evidence and data to policy consultant at WHO East Meridian region with extensive expertise in real-world evidence, health informatics, and value-based healthcare. Ranin focuses on improving health outcomes and optimizing resource across the EM region. She's also led the Health Economics and Value Unit at the Children's Cancer Hospital and is serving as an assistant professor there, driving high-quality evidence generation and advanced decision modeling to inform the policy and clinical practice. Next, we have Dr. Ali Jeremi, Medical Value Lead at Roche, Morocco, a physician with an MPH in public health and health promotion. Ali brings 7 years of medical affairs experience across diverse therapeutic areas in North Africa. Prior to joining pharma, he co-founded multi-award winning digital health projects, building expertise in Africa's digital health space. And beyond medical affairs, Ali is actively engaged in HUR, global health and public health research. We have Amina RAFIKI. Amina is a general manager and region head for Africa, overseeing over 50 countries, building sustainable business and designing disease management models. She's worked at Gilead as a strategic planning and commercial operations lead across multiple geographies before moving to her current role. Prior to Gilead, Amina held senior roles at Roche, Novartis, Nestle, mainly in oncology. She began her career as a research scientist at University of Oslo, authored 10 publications, and holds a PhD in molecular biology and biochemistry. We have Elshahawy. She is the medical affairs manager at the Janssen Pharmaceutical Company of Johnson & Johnson, with extensive experience in oncology across the sub-Saharan Africa and JENA clusters. Lamise has a strong track record in engagement, product planning, medical strategy, execution to improve patient outcomes. She has previously held roles at J&J, Boehringer Ingelheim, and AstraZeneca, driving oncology and diabetes medical affairs initiatives, leading MSL teams and providing scientific support across the Europe and Middle East and Africa region. Lamise is passionate about translating medical insights into actionable strategies to advance patient care. And with that, I hand it over to you, Shereef, to take it forward from here. Welcome you all.
Thank you. Thank you so much, Divya, and thank you for the great introduction. It's great to be amongst you all. And greetings of the day for everyone. So I can see we have a panel of attendees also from across the globe, and I'm sure they have very differing time zones. So thank you for giving up some time for this informative Thursday evening. And I'd like to talk today, to tell you today that we're going to be talking about real-world evidence search and health innovation in Africa. So initially with a spotlight on real-world evidence and digital health transformation in Africa. And if you're joining us live, then you're in for a treat because we, as you've seen, we have an all-star lineup from across both sides of the table that will be talking to us about this today. And we do expect, I think, a lot of questions. So also, if you're joining us, you can see the questions and answer function to the right hand of your screen. You can always, of course, add your questions there, and we'll direct them to the panelists accordingly. So without further ado, with all the introduction already done, that's out of the way, let's start with the discussion itself. And maybe I can throw my first question at Ranin. And with attendees above the 1,000 mark, so I'm expecting we do have juniors amongst us. So initially, let's start with the basics. So it's a question that might seem easy, but initially it's not. So what really is the definition of real-world evidence, and how is it different from randomized clinical trials, and how is this important for healthcare? I think, Ranin, you're on mute.
Okay, now you can hear me. Okay.
Yes, we can hear you perfectly.
Thanks for the nice introduction, and thanks for everyone joining us from all over the globe. So to start to set the pace for this session, so to define the real-world evidence, it is the careful analysis and interpretation of real-world data. So we go to the definition of real-world data. As per the ISPR definition, it is the data that is collected during routine clinical practice outside the context of clinical trials. So anything that is collected during routine clinical practice through different data sources like the electronic medical records, through the health claims, administrative data, all of these things that are done outside controlled measures of a randomized or any controlled trials that are done for just research purposes. This is what we refer to as real-world data. But real-world data, to be converted into real-world evidence, this goes through a process of very careful analysis using rigorous statistical methods. I'm from an academic background, so I just
maybe that's why I asked you.
I would like to highlight on this, not any real-world data can automatically give us evidence. When we say evidence, we're supposed to say that this is high evidence, because poor quality of evidence, we do not take any decisions accordingly. So based on these real-world data, we have to make careful statistical analysis to get the right insights, and also after that, the right interpretation of the findings as well, so that they are applicable to the right context, to the right patients. So after analysis comes the right interpretation from the expert people working on that, and to see the applicability into the context. Because not everything that applies in one country or in one hospital or in one setting can be applicable to the other settings or contexts.
Certainly. Well, thank you. That's very informative and very clear. And I think since we're talking about real world evidence and digital health tools, so maybe I'll shift gears to Ali here. And we were talking in the backstage, and I know you're a physician by training, and you do have also some extensive experience in diabetes and hematology. So how do you see digital health tools, and what are they, and how do they really facilitate your interactions with patients to generate real-world evidence?
So thank you, Shereef, and I'm very glad to be here with this very important panel to discuss an important subject. So I think that the key word here is empowerment. I think that the digital tools today are an important element to empower patients, especially in the African continent. Because this is specifically important for the African continent. As you know, the African continent is going through an important epidemiological transition. The African population is growing, and we're expecting it to be around 25%, to represent up to 25% of the global population. And also the non-communicable diseases are growing very fast, and they are expected to be a leading cause of mortality and morbidity. On the other hand, on the African level, we have resources which are limited number of physicians. So I think that the digital tools can be an important element to solve this complex equation, to meet the needs of the population while serving the underserved areas in a manner that is cost effective and efficient. So, and this is true for real world evidence as well as for digital. And I'm very glad, for instance, in terms of real world evidence project, to see around the African continent studies that are using mobile health applications to do follow-up, to do patient-reported outcomes. And this is very promising experiences that I think that we will see more and more in the near.
It's very important. It's very important indeed. And you mentioned also the current clinical trials are using things like wearables, etc. So that was going to be my next question to you, or maybe Lemis and Amina as well, since they work for Africa. So have you actually worked on something at the moment that does use digital health? Amina, I think you're mute. Sorry.
Yeah, thank you, Shereef. Yes, definitely. Let's start with with kind of statement, saying that digital health is definitely a foundation, to start real world data, as Ranin was saying, and feeding into one day, maybe in very near future, into real world evidences in Africa. We have seen, across Africa, the penetration rate is very good in terms of digital health. It does mean that we are at the level of having like a proper EHRs or a proper real world evidences, but we have very good ground of starting from somewhere. So it goes from, telemedicine. We can see it mainly in, I think Ali has referred to that in many countries in Africa. In Rwanda, for example, in West Africa, a lot of telemedicine is used, to save time for patients and to ease access to remote areas in terms of consultations. But also I've seen even in terms of supply, the drug supply. I have seen many examples. I have met, a couple of stakeholders working in Africa, experts in delivering drugs, via drones and those kind of things. And all those data that are generated are very good, starts to build real world data and later
for evidence.
Evidences. So we have very good examples of digital health across Africa. As I said, mobile health is very well developed, as Ali was mentioning, for adherence, for literacy, for even for payment, for education, and those kind of
projects, yeah.
A part of that, from my side and what I have been seeing, and as a pharma and as a business person, I'm putting myself on the other side. What we have been seeing is a lot of registries, hospital registries, and we have been working with a lot of, mainly in, let's say, North Africa, very well served in terms of registries. North Africa, South Africa, and of course many other regions in across Africa. But justice are very, very common, which are kind of EMRs that are not yet EHRs, but are very common. So this is what I have been working with across the region, and from pharma, from business perspectives, saying so.
Very good. I think, Lamis, you wanted to add something?
Yeah, as my colleagues mentioned, Ranin, Ali, and Amina, I think real-world evidence and digital health tools are critical in Africa because they are the things that are bridging the evidence gaps in diverse population and extend the healthcare access where infrastructure actually is limited. So Africa Digital Health actually opened like 3 big doors. So access, cost, and patient empowerment. So for access, as also Amina mentioned, the rural area used to wait hours or even days for basic care. So the telemedicine here had a solution for that, the telemedicine apps, like we saw it in several countries like South Africa and some mobile clinics like in Kenya. So where the doctor reach a patient without the patient need to travel. And this is very important because around 60% of the African population lives actually in the rural areas. So expand healthcare to unserved areas is very important. The second topic, which is the push. So the solution like Rwanda drone program, which was very innovative to deliver medical supplies to rural areas, which stay days on delays on getting treatment or vaccines. So it was one of the solutions for them, and it cut the cost hugely in this type of countries. Also, the third part is the patient empowerment, as I said. So some SMS campaigns in some of the African countries actually showed how it helped a lot in the patient adherence to their medicine and going to their regular checkups. So even simple innovative idea or even simple SMS can save lives. So the beauty in those programs actually not only to improve the care, but also giving a real world data evidence that could help some governments and payers to see what's working, what's not working, to shape even better policies. So this is the digital health in Africa. As I said, you don't need to have like shiny, innovative apps, but to find simple tools that can make care closer, smarter, and cheaper for the patient.
100%. And yes, I agree with you on the part of being simple or bringing it back to the basics, so you can really shape policies in an emerging market like Africa. And I do agree with that, because I also had an example to share in an African country, and it was also in a therapy area that's undermined by one of the governments, which is osteoporosis. And by the use of digital tools and incorporation within electronic medical records, etc., within the hospitals, then they were able to generate data and actually see for themselves their data that it's really a burden in their country, and they're paying a lot of money on operations that they could save later on. And so it helped both ways. So it helped provide better access or better patient management or patient journey management, and it also helped to spot the light for the policymakers that they really need to focus here. So yeah, that's great. And maybe I'll get back to Ali then on this, because I have a question for Ali and a question for Ranin. And Ali, I know you have a public health background, and that's where I want to touch base on. So when we talk about opportunities, it's always very nice and very shiny, but maybe on the other side, how do we scale this? So adapting anything on the ground sometimes can be very difficult. So from your public health viewpoint, what is the main barrier or the human barrier that stops implementing all these digital health innovative ideas that we're talking about?
Yes, thank you, Shereef. So maybe I will emphasize on what was mentioned by Amina earlier, is that we're seeing a good penetration of internet, of mobile in the African population, but nevertheless, when it comes to digital health literacy, I think that's something is a challenge, because it's not because people have mobile phones that they are using them the right way, and when it comes to health, and this becomes a real challenge, especially today when people have access easily to AI tools that might have a negative impact on their health. This is from one hand. On the other hand, in terms of resistance to change, because when implementing complex digital solutions, it involves many stakeholders. And I think that the more you add stakeholders, the more the thing becomes more complex.
More
And I
complex.
think it's one of an important challenge that we need to tackle in the African level. Sometimes people are used to operate in a certain way. Sometimes they don't see directly the value that you are bringing. So it's something that needs to be tackled very carefully. The last point is regarding capabilities. I think that a lot of efforts have been made on the African level. People are more very comfortable on using digital solutions. But I think that the capabilities still needs to be upscaled to fully get the advantage of these solutions. So basically, these are, in my opinion, the three major human obstacles.
Human obstacles. Very good. And I think also one of our attendees, Dr. Rashid Khan, was also talking about trust in the digital health part. And I think this will be a very good starting point to my question for Ranin. And I think one of the major challenges, from my point of view, and it seems it's also Dr. Rashid's point of view as well, one of the major challenges is the quality of the data or the interoperability of this data. So how can I make sure that really this data is of good quality, therefore I can trust what's coming out of this digital tool or what's coming out of this evidence, and then I can use it to really direct my decisions?
Okay. Let's start with the first part, how to ensure that the data quality is good. And then we will move to the second part, how to make use of the data to make better informed decisions. So there are some specific data quality elements that we have to take care of, including the accuracy, to what extent the data are accurate, completeness of the data. So when we're talking about hospital registries, all required data should be completed, no missing data, because any missing data can give a chance for uncertainty when we do the analysis. Also, timeliness of the data is very important. We don't want to collect and analyze and make decisions on old or outdated data. So we have to make sure that the data timeliness is always updated and revised regularly. validity, which is something that has to be done regularly through data validation, data quality checks by the team who is accountable for this, and accessibility, where the people who actually need the data, they can have it in an easy and approachable way, so the data is accessible. So these are the common data quality pillars. But then it's not just about if you have good quality of data, it automatically leads to good quality of evidence or real world evidence. Yeah. As
we sometimes wish the world was that easy.
Yeah, it's not that easy, but it has to go through the process of good, rigorous analysis and interpretation. And when we're talking about real-world evidence, I want to reflect on the three main pillars of evidence-based medicine that we have always to keep in mind, also when we're applying real-world evidence, that evidence-based medicine at the core is the integration of three main components. The first is the best available research evidence, which is here we're depending on the real world data. The second is clinical expertise, because without the proper interpretation of the data from the clinicians, from the doctors, the data can make no sense in some ways. And third component is the patient values and the patient preferences. So if we go back to the initial definition of evidence-based medicine that has expanded to evidence-based healthcare, it's the integration of best available evidence, that here we're talking about real-world evidence. So this comes from our own data that we analyze, combined and integrated with the clinical expertise to make proper interpretation according to the patient preferences and the population we are looking at to make the evidence-informed decisions.
Very good. So thank you very much for that. And so these are really important things that we really need to keep in mind if we want to upscale the real world evidence and the digital health tools that we're using in Africa. And I think maybe just to summarize all this, and maybe here I'll jump to Amina, if we want to zoom out maybe from a more management or consultancy point of view. From your point of view, I think many pilot projects. So when we have a small project, let's say on a clinic or a small hospital or an idea maybe at the office, but when we scale them to a country level or a sector level, they usually fail. So from your general management perspective, what do you think is the success formula that we really need to make real world evidence and digital health in Africa in the next 5-10 years really worth it?
Yeah, thank you. Before answering your question, I just want to add, a comment on the human barriers that we have in real-world evidence. It's the legal framework, and it's related to trust. And this is very important. The stronger we have a legal framework in place, the easiest we can build a proper databases. In terms of that, we need to have in place. Many countries in Africa, they have, local regulation in terms of data protection.
Sure.
And that's very, very important, to trigger trust either from the healthcare providers or the patients or, anyone, visiting healthcare facilities. So this is a very, very important point. Going back to my practice as a general manager or region head or business person in Africa, dealing with having managed and dealt with a number of trials. It's the first barrier that I have seen is we don't have everywhere strong legal framework. I think that was one of the main barriers, and the trust from healthcare authorities. When you go to a PT committee, it takes a very long time because they don't trust the use of data. They don't trust.
And they don't want to change, like Ali said. They want their own system.
Yes, that's the adoption. This is the main barrier that I have seen when we're launching, some real world evidence studies from registries, because we have been using also registries. Also, as a pharma, it's very it's a challenging, to launch, registries. So important point for success is to partner with local scientific societies. This is very important. Map local regulations and apply by the local regulations. Very, very, very important. And engage very early on, very, very early local regulators, with Ministry of Health, with the ethic committees, with institutions that manage data
stakeholders.
Data protection. I don't. It doesn't exist everywhere, but I know, for example, in North Africa and South Africa, we have. North Africa, mainly Egypt, Morocco, Tunisia, and South Africa. Of course, we have very strong policies in terms of data protection. So we need to engage very early on with regulators, and then collaborate with local scientific societies, for example, engage healthcare professionals very early on, and seek advocacy. That's for me the key success factors. To have successful, not to read word evidence data in a sense that Ranin was explaining, but it's rather a project driven or a therapeutic area driven or question driven. I'm not speaking about from business side perspective that we are looking for to answer one question for one therapeutic area for one intervention. So that's
because we can extrapolate to other drugs, other therapy areas. It's a halo effect. Once the framework is there, it'll be easy to multiply.
Exactly.
And it's very good. I think maybe you inspired a question then I can ask for Lamis. And I think if we're talking registries, data, digital, etc., so we shouldn't miss out on the trends. And I think AI is a trend that's here to stay. So it's come and it's not going, I think. And it's planned to revolutionize how we look at real world evidence and how we analyze things like registries, like Amina just mentioned. So from your experience, how do you think AI will really, or the AI-driven insights will really change our practice? And have you actually started using something like that, or you're still in the planning phase?
So thank you, Shereef. So AI is starting definitely to play a real role in African healthcare, especially in areas where who have a huge disease burdens and too few specialists. So, for example, in South Africa and several African countries, they started to use some AI softwares to read some chest X-rays or read some imaging. That helps doctors also to catch cases faster and at scale, since in many cases their clinics is overwhelmed. So this has helped a lot in the patient pathway. Also, the remote monitoring, like what we have now, like in smartphones or even watches, to have like blood pressure measuring, integrated some AI in medical devices that help the patient's chronic follow-ups, or even integrated the AI in some of our medical education, actually, like having like case simulation, which I use it a lot in with the telemedicine to help to upscale the physician with the live case scenario simulation. So for pharma and medical affairs, this means like two things. We get richer real-world data, as Ranin was mentioning, from a routine care, not just from big trials. So we can get some very rich real-world data from those initiatives and using the AI. And also we can support healthcare workers by training them to understand and use the AI responsibly. So the impact, not just futuristic, it's happening now already. And it's changing how we generate evidence and how patients can get diagnosed. So the AI actually is turning everyday care into measurable evidence and measurable outcome. So definitely it's a game changer, and we need to start implementing more and more in our practice, because it's not near future, it's already happening, and it will help in the decision making as well.
Very good. So thank you for that. And I think when we come to the Q&A part, I can see already with my eyes, there's a lot of questions about AI. So we'll come to that when we come to the questions from the attendees. But I think maybe using the data. So maybe I'll talk here to Ali more because you're in the value access part now. So let's say we already have the data. So you're in the middle of the crossroad between having a chain of data and then the real clinical practice in the field. So how do you and your team actually use this real world evidence to communicate the value of different therapies, let's say to different MOHs or stakeholders, politicians, etc. in Africa, and especially in a complex area like hematology, like you're working in, or oncology? How do you do that with the HCPs or the policymakers, and how do you do it with the patients?
I think, thank you, Shereef, for this great question. I think the first step that we should stop on is regarding the quality of the data that we are using. Because if you're delivering value-based healthcare, it depends mostly on the data, on the evidence that you are generating. And this becomes very complex in our African context, in which there is too much, there is very few interoperabilities between the different systems. For instance, the electronic health records are fragmented. Everyone uses the system that he wants, the way he wants. So I think that the first step is to make sure that we standardize everything, that we develop a common framework for the data, that in terms of methodology, in terms of the data set specifically for the disease areas that we are working on. So I think that that's the most important thing, is that we know to make sure is that what we are using as a data to generate evidence is accurate, is reliable, relevant to the disease area, and also that it brings value to our context. So I think the first step would be to align on the data that we are using and to make sure that it answers this accuracy, relevance, and relevance to it, that it answers the problems that we are trying to answer.
And I think you exert a lot of effort, of course, tailoring this to every different country and all their local needs.
Yeah, absolutely.
Absolutely. And I think that leads me to rephrasing the question again to Ranin. And so I initially talked to Amina about the success factors of a digital health project, etc., and she thankfully answered us a beautiful answer. I'll probably rephrase this to you from a data management point of view. So if I have a small project with data and then I'm going to scale it on the country or sector level, so what's the success formula to make sure that I really do get good quality data when I scale?
Okay, thanks for your question. So when we're working on a small project, like in a hospital based, and we want to expand on a national level, we have to have a very important point in mind that the evidence that we got from one point may not necessarily be applicable on the national level or on the larger scale. So we have to make sure that can be extrapolated to the whole population. And this takes us to some national level measures, like if we're talking about incidence rates or outcomes. So what applies in one institute may not be applicable to the other things. So that's why this is a very important point that we have to keep in mind. Other success factors are the context we are doing. So related to the culture of the people, their perception of real world evidence, to what extent they have the acceptability to apply this, because as been mentioned a few times, the different factor is very important.
Yes.
So the different perceptions, how we accept the use of real world data may be different from one context to another.
Sure.
And the last thing is how it is perceived by the patients, the community, and the public as well. What applies in one context may be not applicable to the other contexts.
Sure, for sure. That totally makes sense. And yes, thinking about the different cultures and the different countries, etc., that you triggered a question that maybe I can direct to Amina, because Amina, building on your international experience, I think you've also covered different areas other than Africa as well. So due to the lack of the policies and regulations in Africa, like you mentioned before, what can Africa really learn from other areas of the world that you worked in on really having a unified, policy or shape for or adoption for real world evidence in digital health?
Yeah, thank you. That's a very good question. Well, Africa need to move forward. As I said, digital health it's a very good start. It's really a ground foundation, to build something starting from there. The second thing that we can learn from other regions is, I can simply say, we don't need to reinvent the wheel. There are platforms. WHO has very nice platform, for example, that is available. We have many open MRIs available, and we have, for example, we can benchmark Europe. We can benchmark also countries like South. I have been working in South and Southeast Asia, where the situation is a little bit much better than in terms of real world evidence and digital health.
Sure.
Much more advanced, I would say,
Well
than
perceived.
Africa. So we can learn from those experiences. We don't need to build from scratch digital tools or digital platforms for collecting data. So we can use those existing data already. We can also use legal frameworks that are working in other parts of the world, either in Europe or as I said, I've been working in South and Southeast Asia, also Eastern Europe, Central Asia as well. So that's something we can learn from. Definitely Africa is progressing nicely and steadily towards a real world evidence system, at certain points of time. But still, I can say that we are really lagging behind Southeast Asia, behind, of course, Western countries, and behind Latin America. But there is a will, not everywhere, but there is a real will and there is a real need. And we have seen it, COVID-19 was like a turning point, inflection point.
Yeah.
In terms of how political institutions, and Ministry of Health handles and see now, managing, those kind of situations that we had out of nowhere. So there is before and after COVID-19, at least,
Correct.
From
the appetite is better.
Perspective, engaging with the Ministry of Health. Everybody wants, to build, very robust healthcare structure. Everybody wants to have databases because they needed, during COVID, to reach out to people remotely, and it really triggers a huge need in developing digital platforms to ease delivering access solutions not only when there is a pandemic or something that happens, which this is something that comes every 30, 40 years or 100 years.
Sure.
But we will have pandemics more and more. But it's not only for that, but also for managing much more healthcare system, and also ease decision making in terms of where I think Africa, as other countries, we are more and more going towards HTA, proper HTA. We have good level of HTA penetration in Egypt, Morocco, and very strong in South Africa already. Other countries are following, Tunisia as well. So we are much more and more going for a true HTA, and payers and reimbursements, institutions would need more and more real world evidence data and evidence of any intervention performance.
Yes, I agree with you, and we've seen the rigorous framework in some of the countries, and specifically I've seen it in South Africa, like you mentioned, and it's although it's delaying the go-to market or the approval of some of the products, but in the end it's giving the right product for the right patient at the right price in those countries. So it's also helping to optimize the market for everyone, and that's very good.
It's still in many countries or many regions across Africa. It's still donors driven, NGOs driven. That's something that we need to change from NGOs driven, donors driven to policies and the Ministry of Health and regulators driven that will be also a good shift in terms of the future of the region. It's mainly for communicable diseases like COVID, like we have a lot of registries and platforms for for follow-up of HIV, viral hepatitis, TB, tuberculosis, vaccinations, mainly, but not really for everything. So that's something also that needs to change. Yeah.
For sure, for sure. And talking about change, then, and maybe I'll take this word and then move on to Lamis and Ali for the remaining question. And maybe I'll start with Lamis. So, how do we internally have to change? So we've seen how it's evolving, how the policy is changing. Amina's told us some countries have moved on to HTA. From your point of view, the path forward, how do we as medical affairs or other departments like market access, etc., how do we need to focus on capability building and be ready for the future?
So thank you, Shereef. So medical affairs actually play a unique role because it's the bridging between science, healthcare system, and patients. So for digital health to grow in Africa, we need several things. So first thing, as you mentioned, the upscaling the healthcare worker. And here, by mentioning the healthcare worker, I'm not talking about all the doctors. As you know, we're also talking about nurses, technicians, anyone involved in the patient journey. But not just only on the medication or the treatment landscape, but also how to use digital tools now and how to interpret data from apps and how to understand the AI generated, for example, imaging and etc. And parallel to that, we need to educate patients in simple local language so they can trust digital. As I saw one of the comments from our attendants talking about trust. So we need to build the trust with the digital platforms and know their data is safe. Without trust, the tool will not succeed. And as Amina mentioned, to build partnership with ministries, with NGOs, through even private tech companies to make sure that innovation is not just a pilot phase, but something that's sustainable. So in the medical affair, actually, we invest in skills and building trust with the digital and new innovative ideas or even platforms to go from just not pilot to have a real impact. And to build also the healthcare community as well by upscaling them.
100%. That's very good. And also, along the same lines, Ali, along the change lines, and I'll ask you a question, but I don't intend to get any confidential information. But with your team or in your company, are you proactively, starting to use real-world evidence and digital health, or is it more of a reactive? Once we get a request, we do it, or is it part of your brand plans?
I think, as already mentioned by Lamis, in medical affairs, the use of real-world evidence in digital health innovation is a key pillar. So absolutely, it's something that we are dealing with on a daily basis to answer the unmet medical needs that are a hurdle and obstacle in access to innovation. So it's something on a daily basis that we are dealing with, working with the different stakeholders, whether they are the government or a scientific association or healthcare provider. So I think it's something specific for all pharma companies, is a key pillar that they are more and more using. And also what I find interesting nowadays is that there is a more and more close collaboration with with tech companies, especially healthcare startups, which is absolutely something very important that we need to invest more. It can help us to provide, to bring the expertise that we might not be having. And also it can help to build the trust with the external stakeholders. When you call for external stakeholders who have expertise, who will be totally independent, I think it's something that we can help us address the issues of the healthcare system. The last thing is that in Africa, before joining pharma, I worked in healthcare startups. And back then, there was a real gap between healthcare providers and tech companies. But nowadays, I think that through different initiatives like the GTEx forum and different startups competitions, there is more communication between the tech community, healthcare providers, and pharma industry. And I think that we should invest, support, listen, and ask these people, because they're bringing a lot of value for the patient, and we will serve better our patient.
That's very good. And
Thank you.
yes.
We are all on top of that.
Oh,
But it was
the time's finished. Very good.
yes.
Where the discussion took us, actually, I'm just skimming through the questions. If there's anything we didn't.
Yes, and we could respond over an email to the audience. If there's something crucial you would like to address, we can respond to them over an email.
That would be very good. Yeah, but I think skimming with my eyes, I think we've managed everything. So the majority
Yes.
of the comments are about the trust, way forward, AI, and I think these are all things we talked about tonight,
Correct.
as well as the legal requirements and consistencies. So I think with this, we need to close for the session. I'd initially, of course, like to thank all the panelists for bringing all their experiences to the table. So thank you all for that. I'd also like to thank the organizing committee at Real World Evidence Search and Health Innovation Summit, and all our colleagues in the backstage from Healthark Insights for bringing this evening to the light. So thank you all. And if you want to join the recorded session, please see it once it's uploaded.
Okay. Thank you so much, everyone.
Thank you all and have a good night.
Thank you. Bye-bye.
Thank you.
Thank you. Bye-bye.
Everyone.